people who are even non-smokers, they are having a history and incidence of lung cancers.
What about young students who are going to schools, young children who are just stepping out of their homes and stepping into maybe their first nursery grade and they are going to the schools? What about them? What about their lungs?
The point is, I tell you one thing, that the young age is like a small plant or a small baby animal. So the point is, the young age is when we give a lot of nourishment, so that their growth patterns should either physical, emotional and mental, all at growth, all levels should happen. But the only thing is, they have to have a good fuel. The toxic air, the bad quality of air is going to affect first the eyes, which is burning and they have a vision issues. Then the nose, then you have nasal issues, you have throat issues, you have recurrent chest infections, upper respiratory infections. Then there is very high incidence of bronchitis. Then after even that, this irritable symptoms, you have more incidence of infections. You are having more incidence of chest infections. The child has hampered period of growth also, because they are into the disease process, and they visit the amount of visits to the pediatricians and the physicians is more. The growth is also getting hampered. So overall, it's a big disaster.
When we talk about the elders, the senior citizens, people above 60, how does toxic air, the pollutants, impact their health?
The elderly, the problem is they are on some or the other comorbidity. Either in normal, although usually people keep healthy these days and they're very aware, but still somebody have diabetes, blood pressure, some cardiac illness, maybe some obesity, or so the overall medication is already on. But overall, the extreme age, both sides, the younger age and the elderlies, they have a propensity of low immunity. So the immune system is already compromised in them. So if overall with this toxic nature of the gas and the pollutants, it will further going to suppress the immunity, and so they have a high likely chance of getting the infections. So they have high chance of getting pneumonias, the upper respiratory infections, and even the recovery, even after medication is getting delayed. The same antibiotics, same anti-inflammatories and same anti-allergics are taking more time for the response. So they are landing up in more morbidity because they don't have a reserve. So already the weight is less, they're already suffering, and if they get a hit from this kind of pollution with some infection, their recovery is delayed. So it's really troublesome for them, really troublesome.
What precautionary measures should be taken to keep oneself safe?
So I would recommend 2-3 things that we have to abide by the government regulatories, and they have been very stringent in the last few years. And the most important thing is that we should follow the laws. The second thing is, I would recommend that there are two components to it, that how can we prevent getting into this trouble, and if we are in a problem, then how should we cure it. So as a preventive aspect, we have two things. That one is we should have limited outdoor activity, and it should apply to all the age group, even the youth, the younger and the elderly, all age group. And we should wear mask as much as we are being exposed outside. So we should wear a mask, a proper mask which really works for you, and it should be properly snugly fit. So you should know what we should be conscious about it. Second thing is that we should have minimum vehicle pollution. So use public transports and you go only if it is needed outside. Then third is that I would recommend a lifestyle modification. So what people don't understand is that whatever nutrition you are taking, how much content of water you are taking is really effective. So you hydrate yourself properly. You should be having a 2.5-3 liters of water per day. Then you should have good nutrition, good rich diet of protein and vitamins. You can take some supplements of zinc and vitamin C, which is going to boost your immunity. Take your regular medications. Then the most important thing is, you should, whenever you are coming back, you should take a bath properly. So clean up yourself, wash your clothes properly so that the particulate matter should go away. Then I would recommend that we should also think about doing a proper yoga and breathing exercises, because they really help out. It's more of cleansing phenomena. Then the important thing is that you should also take care of your sleep, which is a very, very important thing. If you sleep well, sleep is a healing process. So if you sleep for 8 to 10 hours or whatever is permissible, if you sleep adequately, I think the healing process is on. So try to be indoors, take good food, good amount of water, good sleep, and do yoga and exercise.
Healthy India की trusted lab.